Hello, everybody. I'm Dr. Margaret Rutherford. It's great to be back here on Mental Health on the Mighty. It's always an honor. I've been doing this since 2016, and I could not be happier to be with all of you today. Just a little bit about myself as people get on. I'm a clinical psychologist. I've lived in Fayetteville, Arkansas since 1992 or 3, sometime in there, and started a practice in 93. And I was just a therapist. I loved being a therapist. I didn't want to be anything else. And yet, when my son left for college, I decided to do some writing. And so I started a blog, and that's drmargaretrutherford.com, at least now, in its present iteration, as they would say. And then I just got even more determined and started a podcast in 2016. I was really determined, I'll use that word again, to try to take the stigma out of mental illness and mental illness treatment, by just simply starting to let people know what a psychologist is like to talk to. We laugh, we make fun of ourselves, we're just people. And yet we can act as consultants and as guides to mental illness because sometimes we've struggled with it ourselves. And so we have that experience, but sometimes, I've had 28 years of listening to people and trying to help guide them, or I've learned a lot from them over the years as well about, how to get through really, really tough times and times that maybe you think are so intolerable you can't get through them. So I'm, again, honored to be here. I see some of you are around. That's wonderful. Hello, Rick and Maria and Dana, Brandon. Brandon, I used to live in Texas, so I lived in Dallas. In fact, that's where I got my training at UT Southwestern Medical School. So today we've got a lot on our plate. We're going to be talking about suicide. And before we begin, I want to make sure that all of you, Camera is going to, from the Mighty, is going to put access to actually worldwide suicide prevention centers. Someone who actually listens to me from Germany sent me that the other day when I was going to do, she saw that I was doing this. And so it has all the countries listed that do have suicide prevention centers and the numbers and how to reach them. So I hope that's helpful to you. And because we certainly don't want to trigger anybody today, but as one of the myths will tell us about suicide, the more you talk about it, actually, the more it opens conversation up about it. So what today is all about is sort of what I call debunking the myths of suicidal ideation and suicidal thoughts, because there are a lot of them. I actually looked at literature from NAMI, or the National Alliance of Mental Illness, from a healthcare organization, Magellan Health, had some interesting things to say. And also there was an article by on NPR, National Public Radio, that was very helpful. So that's what we're talking about today. I feel free to comment. Would love to hear questions and comments all throughout the time. Let me see here. Oh, you're from Nashville? Hello from Indiana. And from Ireland. Great. That's wonderful. Wow. Right now, this time, if we had not had the pandemic, which of course we do and we're all dealing with, I would be in New Zealand right now celebrating my 30th wedding anniversary. So we celebrated last night, and one would have thought that the night was never going to end. So if I seem a little woozy, that's why. But we had a great time. We talked with friends via Zoom. It was wonderful. Okay, and I see we are starting to get. So after my last attempt, I felt like I lost my will to function. Any tips on recovery? Sure, Kelsey. Let me get to that. Let's first talk about the myths. And again, I found 12 of them. I thought this was a fascinating statistic. If all the people who had attempted suicide in the United States were actually completed those suicides, it's a funny word to use, but that'd be 1.4 million attempts, and suicide would vastly overwhelm cardiac arrest as the leading cause of death. That's phenomenal. And of course, worldwide suicides, I think the first article I found was 2004, that suicides for years had far outweighed homicides and even war casualties. So this is a huge problem. And because we're in Suicide Awareness Prevention Month in September, we decided we really wanted to talk about it. And Robert, you're from my hometown. Oh, it does suck a little bit, but you know what? We had fun anyway, so that's okay. 30 years is 30 years. And he asked me the night before, he turned around and said, Margaret, will you spend the rest of your life with me? So it was really sweet. Oh, it's going to make me cry. Okay. So let's talk about the myths of suicide a little bit. Number one, it only affects individuals with a mental health condition. Actually, research has found that 46% of people who die by suicide had a known mental health condition. So that's 54% did not. Usually it can be triggered by all kinds of things, criminal, legal matters, persecution, the loss of your home, the death of a loved one, a devastating or debilitating illness, trauma, sexual abuse, rejection, or some sort of impending crisis. As I read these to you right now, I'm thinking about the thing that I wanted to say at the very first that I did not, so I'll say it now. Our hearts go out to so many of you who've lost homes, who may have lost people that you loved from the fires in the Pacific Northwest and in California, Utah, Colorado. I can only watch it and just say, oh my gosh, how do you ever recover from something like that? And then now we have the tropical storm, I believe it's Sally, and then there was devastation in Texas. So many parts of the country are struggling. And of course, I just read you that, a crisis can cause increased suicidal ideation, and we already have the pandemic going on. So this is a real trouble spot, and there was an article I read that said it was sort of a perfect storm for suicide to increase even more. Let me look at some of the questions. I think it's Allie. My brother calls getting treatment for mental illness is like playing Russian roulette with your brain chemistry. Is this true? Must be, my brother says. Well, no, I wouldn't agree with him, because there's certainly a lot of research-based techniques now that work, that have proven their worth, and that many therapists are trained in them. I'm trained, for example, in hypnosis. I'm also trained in EMDR, but there are all kinds of things. Cognitive behavioral therapy has been shown to be excellent for depression. And there are all kinds of things like that. So I'm not sure what he means. I mean, I think I've seen some studies where they look at depressed people with depression. They look at their brain scans, and do their brain scans change after therapy? Yes, because it also happens if you just get better from depression. Your brain will look different on a scan. So it sounds like your brother may have had a negative kind of relationship with a therapist, or something bad happened. So, but to just whitewash it and say, oh yeah, this is just crummy, it's dangerous to go into therapy, I certainly wouldn't agree with him. I've been in therapy a lot over the years, and I'm a therapist because therapy really helped me. Okay, let's talk about the second myth. Once an individual is suicidal, he or she will always remain suicidal. Now, there is a little debate about this, but remember, 54% of people who are suicidal have not had a diagnosis of mental illness. They're actually just trying to handle deep, painful emotions that they just don't know what to do with. But it's also true, this probably depends on the actual diagnosis the person has. If a person attempts suicide and survives, they may make a further attempt. It's a myth that they won't. So this is especially true with people who struggle with something like borderline personality disorder or chronic recurrent major depression. So it doesn't guarantee that there will be. I mean, certainly people can have suicidal ideation, and they can get better and never have it again. But then there's a subset of people who also struggle. Okay, one more. Sarah, I have bipolar, schizoaffective disorder, borderline personality disorder, and severe anxiety. Is there any chance I can ever break free from suicidal ideas? Wow, Sarah, that's a lot. Yes, yes and no, I guess. I've had patients who have told me that they've gone years and years and years, and almost, as soon as they wake up, they have a thought about dying, or maybe it's not actually a plan to die, but they have just sort of thoughts that if they got hit by a truck, it'd be okay. But I think that if there are things. I have a patient right now, for example, who's getting ketamine infusions. About once every 6 months, his suicidal ideation gets more severe. And so the ketamine really has helped. I think I had another patient who did transcranial magnetic stimulation. She was chronically suicidal, and all that has gone away. So there are new treatments, as well as tried and true treatments like talk therapy, of course, and cognitive behavioral therapy. I really think that obviously you have a lot going on. And if you have schizoaffective disorder, then that means, of course, that you tend to get psychotic when you actually get very emotional. You add borderline onto that. And of course, borderline is in and of itself, suicidal ideation is a part of it. It's a diagnosis with it. And of course, major depression is too. Can also happen with bipolar disorder. So you've got your work cut out for you. But I would really do some work on what are your triggers. Maybe really try to work on that, and then maybe change some things in your situation if you can. Look for what you have control over. Let's talk a little bit about the fact that fourth myth, which is most suicides happen suddenly without warning. That's not true. There are three major causes. Hopelessness, impulsivity is one of them. Hopelessness, impulsivity, and a feeling that people would be better off without you. But impulsive suicides are not, they can happen, but they also are not, suicides are not always impulsive. People, even especially teenagers, will leave notes about, death or wishing they weren't here, or they'll tell friends things like they, just wish they'd disappear or something like that. So a lot of times suicides are very well planned. Those of you who've listened to my podcast, the Self-Work podcast, or have been on here and know that I've written a book called Perfectly Hidden Depression, How to Break Free from the Perfectionism That Masks Your Depression. And so those people, perfectionists, certainly a lot of the suicides that I've heard about for people who've been hiding their depression through perfectionism, they are very well planned out. There's a great book called What Made Maddie Run. And it's about a college athlete who actually died by suicide. And she had left a complete, gift wrapped packages for her family, and with notes. And she had planned it out very in detail. So it's not always impulsive. Okay. Mal. Thank you so much for this. What is the most effective therapy for those who survived suicide of a loved one? Well, yeah, I have, I have not had that happen to me. I've had 3 of my patients die by suicide, and I took that very hard. I'm not going to go into the circumstances, but over the years it has happened. And I know what I had to do to take care of myself was that I got into therapy, and I talked about my grief, and I talked about my sense of helplessness, and I talked about some sense of guilt, and I talked about everything. And I just talked and talked and talked. And so, there can be such confusion. In fact, Dak Prescott, I don't know if y'all know who he is. He's the quarterback of the Dallas Cowboys. His brother died by suicide fairly recently. It was last spring, I believe. And he has a new interview on about how he handled it. And it is, he actually has been very open about getting mental health treatment for depression and anxiety. And so more and more people are beginning to understand that you need compassion. You need a safe space to talk about your anger or your sadness, again, your confusion. And a lot of times we don't know why someone decided to die. We just don't know. They don't even leave a note. Again, those are probably not, well, there's maybe more impulsive suicides, or maybe just people don't want us to know. So I know that's a kind of generic answer, but I think that it's so devastating that it just takes a long time. There's a group, there are other support groups as well. There's one here in my hometown. It's called Parents Left Behind, and they have they meet monthly to talk about the children that have died. And there's a subgroup that's for children who've died by suicide. Karen, my partner tragically died by suicide. It changed my life and mental health forever. I wish there was more support for mental health in the UK and that more men would speak out about their struggles with mental health. Suicide is never a positive choice. Please do reach out. Thank you for any discussion on suicide. It's good to talk. Yeah, it is. I'm not trying to push my podcast on y'all, but I have a podcast called the Self-Work Podcast. And about 5 episodes ago, I interviewed John Moe, who has done the wonderful podcast, The Hilarious World of Depression. He's a NPR journalist, and he's a comic. And so he interviews celebrities and comics about their struggles with depression. But he also has been actively suicidal all his life until his brother died by suicide. And that took suicide off the table for him. He speaks eloquently about it. Again, my podcast is the Self-Work Podcast with Dr. Margaret Rutherford, and it's the John Moe episode. It says a conversation with John Moe. I think this week will be 198. I think it's 194, episode 194, something like that. He really, I would bow to him because he's lived it and walked it. And he said, so sadly, he said, people think that their troubles are going to end and that they'll get away from the pain they feel. No, they don't. They just don't feel anything anymore. They're gone. It's almost as if they think that somehow or another they're going to feel better. It's an odd space that your brain can get into. Let's talk a little bit about risk factors. A family history of suicide, it almost like it gives people permission to think about doing that. Substance use, intoxication, access to firearms, a serious or chronic medical illness, your gender. Women are 4 times more likely to attempt suicide, but men's methods are far more lethal. So more men die by suicide. A history of trauma or abuse, prolonged stress, or recent tragedy or loss. And again, we're living in the middle of a pandemic. And so I read one article that said this pandemic is a perfect storm for suicide rates to exponentially go up. They're already exponentially going up, internationally, in fact. Karen, my family just doesn't understand mental health, especially during our grandson's death recently. Yeah. Gosh, Karen, have I ever heard this over and over and over again, that there are families that just sort of refuse to grieve. They stay in either denial about it, or they think it's weak, or they think that it's, and people of faith may get on to me about this, but, I've even heard people say to someone, you shouldn't be grieving because your loved one is in heaven. And that may be your way of handling grief, but I wouldn't ever say that to somebody else, because grieving is very unique. And whether you believe in that or not, it's still, you lost someone, and you may be confused and so lost about why they did what they did. Some suicides are, it's kind of apparent. I remember a man I worked with whose son had chronic schizophrenia that they could not get it under control. The medications just didn't work for him. And so he died by suicide. And his father understood. Of course, he was deeply saddened and also deeply guilty. But, he understood that his son had just reached a place where he couldn't tolerate it anymore. Sarah, it's so hard to get therapy in my area. I wait up for 2 months for an appointment. There's just too many people for the number of therapists. But I'm in crisis. I have no options. Well, you do have an option, and that option is to call one of those suicide crisis lines. In fact, that's what they're there for. And they're there 24 hours a day, 7 days a week. And so I would reach out to them. Also, I don't know where you live, but there are services like Talk Therapy, Talk Space, BetterHelp here in the United States, and they're probably international. Now, you have to be careful with suicidal ideation because they will say if you're actively suicidal, then you need to go to the hospital. And the hospital will help you. But you're right. I mean, I know that in many areas there are not enough therapists, and talking with trusted friends, just letting yourself talk about what's going on. Someone sending you hugs, Sherry. That's great. So back to the myths. This is a good one. Well, it's not a good one. It's a myth. People who die by suicide are selfish and take the easy way out. No. Now, I will say that depression in and of itself is very self-oriented. You tend to have great difficulty getting out of your own thoughts about yourself, what you're feeling, what you're thinking, what you're experiencing. That's a symptom of the disease. But the choice to take your own life is not a selfish choice. People are lost. People don't know what else to do. I think that there's a kind of state of mind that must happen. Obviously, we don't get to talk to people after they've died by suicide, but there must be a state of mind that happens where they just almost dissociate from the reality of what they're doing. Sixth myth, that's hard to say. It's best not to plant the idea of suicide by talking about it with someone who seems depressed. Wrong. You're not going to make somebody think more about suicide if they're already depressed. In fact, if anything, asking them a question like, well, is it bad enough to where you sometimes think about hurting yourself? It gives them permission to talk about it. They may not be talking about it because they think you would freak out. I have a friend, a very good friend, who deals with severe depression from time to time. And she will talk to me about, I have these thoughts, I can't get them out of my head. And she goes into therapy and to handle them. But I'm glad she has me to talk to because, she can vent and let me know just how bad it can get. Karen, Louise, the mental health stigma needs to stop and people need to talk to professionals or trusted friends for sure. You bet. Let's see, Sherry, how do I get over my ex not taking me seriously when I told him that I was going to attempt suicide 2 days before? I had all the pills ready as well. Unfortunately, my 9-year-old saw me laying there as well once it happened. He's the one who told his dad to call 911. Sherry, I don't know the answer to your question. It may be that certainly if you've talked about it a lot, if you've threatened it or said you feel that way frequently, then people can grow immune to it. And that may seem cold and aloof, but they can say, well, you've said that many times and I don't really believe you anymore. Or, he may have thought if you were saying something about it, that you wouldn't really do it. But obviously you did try and you did attempt. I'm so sorry for whatever's going on in your life that you would see that. And I hope that you and your 9-year-old also got some help for all that. But you know what? I also think that some people are in denial about just how severely depressed other people are. So In fact, again, I've written a book on perfectionism and depression, so people reach out to me all the time telling me about deaths that occur to people who don't look at all depressed. And I got one back in May, a very poignant one. And, no one knew this woman was highly depressed and significantly depressed, and she hid it. But I also learned later that she actually had tried to go to the doctor, and she actually told one person that the doctor said, well, you may be suicidal, but you don't seem to be hospitalizable. So he let her go, and she made the person promise not to tell who had known that she'd gone to the doctor. I want to say to all of you, someone talking about suicide is not a promise you can keep. You just have to look at them and say, I can't keep this promise. It's too serious. Your family needs to know. I'm sorry, I may lose your friendship, but I can't keep the secret. Okay, strongly suggest that. It's not just a suggestion. You can't keep suicidality a secret. It's too dangerous. All right, back to the myths. Suicide happens more often during the holidays, such as Christmas and Thanksgiving. Not true. Suicide rates are actually lowest in December and peak during the spring. If a person is determined to commit suicide, nothing will stop them. This is myth number 8. John Moe, again, talks about this a lot. He says, for example, a lot of people will jump off bridges to kill themselves, and there are barriers up now. And he actually went to a bridge in Seattle and was very seriously considering suicide, and he saw those barriers. And it was almost like in his mind, someone was whispering in his ear, there are people who don't want you to do this. And all of a sudden he remembered his wife, he remembered his kids, and he backed off. So you don't know what will help someone decide not to commit suicide or not to die by suicide. You just need to notice and say something and erect all those barriers you can, because that will help people remember. Simone. Oh, wait a minute. Karen, what is the difference between thoughts of suicide and horrific temptations? I don't know what horrific temptations are. There's a difference between thoughts of a welcome death and actual suicidal ideation, if that's what you mean. Thoughts of a welcome death are literally, I wouldn't kill myself, but I wouldn't mind if I died. Whereas suicidal ideation is that you actually are thinking of how you might kill yourself and what you would do. Now, Simone, my 30-year-old son took his life, while living in Calgary. We live in Ontario. Waiting for him to come home was devastating. I wanted and needed to be there with him, but couldn't. I will never get over this. It will be 6 years this January. I think of him daily. I'm in a constant state of sadness and depression. Of course, I would be. Who wouldn't be? I wonder if you think there's help for someone like me. First, again, I'm so sorry. I don't know what kind of pain your son was in, but he didn't want you to know about it. He didn't want you to know how serious it was, or he would have asked for help. He would have said, Mom, I'm in trouble, and you would have dropped everything to go be with him. So the people that I have worked with that have seemed to not only work through just the death of their adult children or children in general, but suicide, have to get on the side. They have to work through all the stages of grief. And it does sound like you're stuck in guilt. Have you worked through anger? Have you worked through, just fear? Have you worked through disappointment? Have you worked through so many things? I mean, what have you done to figure out, why he all of a sudden, or maybe not all of a sudden, were there signs? I mean, but again, he didn't tell you. And so I don't know of a human being other than someone who might be sociopathic that would hear someone say, I have thoughts about hurting myself, and not rush to their side. So to be with them and to hold their hand and say, let's go to treatment. Let's get you treatment that you need. So I don't know, Simone, if perhaps you haven't worked through the other emotions. And I would highly recommend that you do. If you haven't gotten therapy, sometimes you can be stuck in the trauma of when you found out, how you found out. You could even flash back to that scene in your mind constantly. And so EMDR or some sort of trauma-based work, eye movement desensitization and reprocessing therapy could be very helpful because it helps you remember a trauma, but not have a serious and emotional reaction to it. So I would seek something like that as well, because again, I'll never forget, my parents died naturally, but I'll never forget where I was when I was told they were dead. So, and my clients that had died by suicide, I know exactly where I was then as well. Olivia, what about children that talk of suicide? There's little to no support for kids who have severe anxiety. What resources are available online for them? Well, I don't see children, so I don't know much about that, except that if they're children, I would say online resources are probably not very helpful, maybe to the parents. But I always recommend for anyone about under the age of 8 to 10, depending on their emotional maturity, they get play therapy. So, and play therapists are wonderful at looking at the themes that are present in children's play and beginning to try to help them through whatever anxiety there is. But some of the myths did have to do with children. So let me go over there. Let's see here. Teenagers are not the highest risk group, but it's growing. The suicidal thoughts or attempts doubled between 2008 and 2015. Right now, it's 13 per 100,000, 15 to 24-year-olds. Again, what we talked about a few minutes ago, a lot of times kids leave clues. It's also a myth that a child under the age of 12 can commit suicide or can want to die by suicide. It is rare. And but it can happen. And some people say, oh, it never happens. And even some of the professional literature will say that would never happen. But it does happen rarely. Also, another myth is that when a suicide happens at a school, that the best thing to do is to have a big assembly about it. That's not the best thing to do. The best thing to do is to break up into smaller groups. There's a thing called copycat suicide, and especially teenagers are wanting to be like other teenagers, and they'll hear about a suicide and they start ruminating on it, and they think that's what I should do. And so that can be a real problem, and especially if you sort of induce a school-wide sort of hysteria about it. So you want to keep things in small groups and let people who are more directly affected by it talk about how they're feeling. Let's see, Sherry, is it possible to be suicidal due to traumatic events and not depression every day? Yeah, sure. Yes. Trauma is huge in depression and anxiety. And we're getting to know more and more about trauma. So, and it's important to understand as well that the trauma research talks about big T and little t, where big T is more like really, war, being at war, or rapes or tornadoes or pandemics. Little t is much more like something more chronic, like bullying. But, there can be, unfortunately, a lot of trauma at home. And so people, yes, can get very suicidal through that. Nikki, you're welcome. Thank you. Karen, horrific temptations has been explained to me as temptations to hurt myself. Well, if it's self-destructive tendencies or self-harm, that may be what you're talking about, which again is a little different from actual suicidal ideation or thoughts of a welcome death, because self-harm, you're usually doing something physical. You're burning yourself, you're cutting yourself, with the thought being that that's easier to feel, that pain is easier to feel than the pain you are feeling, and you're very tempted to do that. But I've never heard that terminology. Karen, I wouldn't personally signpost any child to anything online, but I definitely suggest youth counseling. Doctor's referral to mental health support. Sure, sure, sure. Yeah. What's wonderful about play therapy, my son was in play therapy. I told the therapist one time that I wish I could come to it too, because it looked like, she was so compassionate and wonderful. And they think they're just going to play with an adult who wants to play with them. There's no onus on it at all. It's not sitting and talking to somebody. It's sitting, and they usually have this big, room full of toys, but you can see the themes in their behavior and in their choices. So, I let's see if I've skipped any. No, I think we've covered them all. So I think that, let me see, someone says, Diane. Hi, Diane. I was 12 for my first attempt. My last time was a year ago, now 50. I live with trauma and depression. I know self-harm, cutting, it's easier than feeling what I've lived through. Okay. I've actually had two kinds of people tell me about self-harm. One is that they do feel the physical pain, and that's to distract themselves from the deeper emotional pain that they feel. I've also had people say they actually dissociate from the physical pain. It just feels as if it's justified to hurt themselves. But they don't feel any physical pain from it. So I don't know much more than that. It's just a very unique kind of experience. Joshua, what about picking skin, biting cheeks, etc.? Is that considered self-harm? I have not considered it self-harm exactly. Now, if it's really like you bite your fingernails and they're bleeding, but so often that is nervous tics or anxiety, symptoms of anxiety. Now, again, it's sort of to the extent that you do it. And if you're conscious of it, a lot of times those kinds of things you're not conscious of doing, but when it's self-harm, you're very conscious of doing it. So it's to help you deal with what you think you can't deal with. And that's what therapy is all about, is to learn to teach you how to, in fact, we talked in our last Mighty, Mental Health on the Mighty, about DBT and the Dear Man technique, which is about learning to handle emotions that are really stronger than you and stronger and really overwhelm you, but you can learn to deal with them rationally. I live in Northern Ireland, and there are so many suicides, especially in young people. I suffer from depression and anxiety, which sometimes makes me afraid that I will do it too, but don't want to. But I feel emotionally in pain all the time. Gosh, Suzanne, I'm so sorry. Yes, I mean, it can be part of the zeitgeist of a community. Zeitgeist being, kind of the habits of a culture or a community or a country even. And so it's good that you're afraid. That is a really good thing, that this scares you, the thought scares you. And as long as you feel that way, it becomes dangerous when it no longer scares you. Or you kind of, what we said before, you dissociate a little bit from the idea, or you see it just as an act, but not the end of your life. One of the things that I don't know exactly what's going on in Ireland that would make this a time, maybe it's poverty, or maybe it's, I don't know. I've never been there. I don't have any really preconceptions, or it could be a traumatic time in Ireland. But young people, there are these sort of copycat suicides that are happening, and they're very scary. And so you want to make sure. I gave a talk yesterday to a podcast that was talking to teens about depression. And I think the best thing that you as a parent can do for your child is to talk about your own vulnerabilities. Not in a non-age appropriate way, but in a way where if you struggle with sadness, if you tend to get mad too quickly, or you are an impatient person, or you deal with sadness or depression sometimes, talking about that with your child, again, in an age appropriate way, can give them permission to talk to you if it happens to them, because they know that you have the capability of talking about it. So I would look for people who, in your peer support group, or to say, gosh, we need to support each other in what's positive in our lives, but also be able to talk about when we get overwhelmed. And I would look for people like that to help support you, and to help, when you're down and when you're having a rough day, you can turn to them, and then you can give that gift when it's your turn. Okay, so Ted, this is somebody new. I suffer from bipolar and was forced to resign from teaching. Depression is very hard. How do you find a new purpose after 15 years of working? Wow. Well, I think you can look at it a lot of different ways. I'm sorry your bipolar illness got, to the point where I guess it wasn't controllable enough, and was beginning to affect your teaching. I don't know if you sort of fired yourself, or you said, no, you said you were forced to resign. So, okay. Actually, in the United States, that would be against the law. I don't know about other countries. But you can't be fired for a mental illness. I mean, they can suggest you take family leave and get treatment or something, but they have to work with you about it. And of course, a lot of people do get mental health disability who've lost their jobs because of mental health issues. But for that part of you that loves to teach, maybe there are other opportunities. Maybe there's a community group for people, for kids, like Boys and Girls Club, or there's something in your community where kids can go after school to get help. So you could teach, you could be a mentor and a tutor. Maybe there are people in your family. Maybe I know some previous teachers who volunteer for literacy councils, so they teach people how to read. So you can take care of that teaching part of you by looking for other avenues to teach. I started being a psychologist because I volunteered at the battered women's shelter in Dallas, and I learned how much I appreciated, and that I had a capacity for compassion. That I was a jingle singer at the time, and I didn't really know I had that capacity, and all of a sudden I found it in myself. So I started looking for opportunities to use that capacity. So you still are a teacher. You will always be a teacher. You just need to find another venue to teach. And that, I don't mean to sound overly simplistic about that, but maybe that's an idea that hasn't occurred to you. Is it normal, Stuart? Is it normal for anxiety and depression to give you dizziness and headaches? My doctor says it is. I passed out for the first time in my life on Friday. Whoa. Stuart, I would go get a second opinion. Yes, dizziness and headaches can be a part of especially anxiety. But if you passed out, then that's pretty serious. And I think your doctor may be not paying enough attention to that. So I would definitely go for a second opinion. And now, if that's associated with any kind of drug use or something like that, then that might be another story. But I wouldn't just settle for, oh, that's anxiety, because there could be something else going on. You could have some thyroid issues, blood sugar issues. I'm not an MD, so I have to be careful here, but you could have passed out from low blood sugar. And there are other things that, something neurological could be wrong. So you definitely want to get a doctor who's going to listen to you better and not just say, oh, that's your anxiety. Brooke, hi. I have severe PTSD from long-term sexual abuse as a child. I'm also medicated for bipolar disorder. I personally have lived with the thought of suicide in the back of my head. Sometimes it's a very quick flip from just the thought to actively thinking about doing it. Hi, Brooke. I'm so saddened by hearing about the long-term sexual abuse. And, the picture that came up when your name came up is, I guess, you on a horse. So obviously you've done some natural equine therapy, maybe, and that's good. And, that flip can happen where it's at the back of your mind and it's just kind of always sitting around. And then all of a sudden you can see yourself doing it. So I would Again, try to find a therapist or a trusted friend that would help you figure out, okay, when does that happen? What's happening when that happens? You know, am I not sleeping? Is there something about, have I not exercised? Have I been around people who exacerbate or worsen my sense of abuse or my memories of abuse? Am I around family members who didn't believe me? I mean, all kinds of things could be a part of that. And so you really want to try to figure out what are the triggers of what causes that flip so that you can better understand it and try to do something about it. Again, sometimes you don't need a therapist for that if you really stop and think. Sorry, I'm having little throat noises here. I guess you can hear them. I can hear them. Christopher, there's a grisly video of a suicide. Oh, that's horrible. Embedded in TikTok and Snapchat. I'm sure it's traumatizing. And, why people do that is just beyond me. If they've ever had someone they love die by suicide, they would not do that. It's shock value. They're trying to get views. It's just ridiculous. Diane, I have my letter written to my family. I'm a burden to them, and I know that I feel them pulling away because I'm not getting better. Diane, you need help right now. Right now. Please call the suicide hotline. Please reach out to a family member. Yes, sometimes people don't know what to do when you're depressed. And if it's recurrent and chronic, they don't know, but they don't want to go to your funeral either. So you have to tell them how bad it is. Please call the suicide hotline here in the United States or whatever suicide hotline there is. You've got to do something about this. You're on the brink of something and you don't want to play around with that. Please. So let's see. Ted, thank you. I did apply for SSD and was awarded that just this week, just lost in depression. I get it. Ted, it's hard to kind of reinvent yourself. And this was an unexpected thing. And so please, just try to think, well, what else could I do? How else? What? I just saw this today. There's a TED Talk called The Why. And it talks about the why TED Talk or something like that. And it talks about finding your purpose. So I hope you do that. Really hope you do that. And again, Diane, please reach out and take care of yourself. Use the Mighty. There are people who write about it on the Mighty. There are people who have been in the same boat you are. And there is another way. I know. I've seen people be suicidal and then look back on it and think, how could I have thought that? So please get the help you need. Okay, let's see. Let me see if there's some new comments. She says, please do not feel that you are a burden. I guarantee you that you are loved and you are worthy of a good life. Sending hugs and strength, and reach out to a friend and professionals ASAP. Please don't feel alone. That's right. People just sometimes don't realize how bad it is if you don't tell them. And you think you're giving them all kinds of signs, but people aren't good at seeing it. It's hard to see. They blame themselves, and so they stay away from it. But you can do something about it. Okay, so we're off for today. Thank you so much for your questions and comments. I'll be back next month, October the 21st. Actually, I looked at 3 o'clock Central Standard Time. Not sure what we'll be talking about, but I hope all of you will join me. And please take care of yourself. Take care for now.